Hello, my name is Martha. I'm here with CoppaFeel today. Would you like to introduce yourself?
Hello, Martha. I'm Dr Bartholomeuz. I'm a GP in Nottinghamshire. I've been involved working with clinicians in East Midlands developing a new pathway for managing women who present with breast pain alone as a symptom.
So earlier this year, I had to go to the GP for breast symptoms. And I wanted to speak to you a little bit more about what people can expect when going to a GP for the first time. So when you make an initial appointment with the GP for breast pain, what can someone kind of expect to happen?
So when you do come to a GP surgery and you book that appointment to discuss breast pain, which is a concern, the GP will obviously want to know a bit more about it and will have a conversation with you to get a bit more detailed information regarding the breast pain. Things might be, when did you first notice it? What type of a pain is it? Is it on one side? Is it affecting both your breast? How does that relate to your periods? What have you been doing? Whether you've been doing any sports, any extra activity, running, jogging. Have you noticed anything that brings it on? And equally, what have you been doing to help ease it or get rid of it? So a bit further information to understand what this pain is. They may also ask you some further information such as, are you worried about anything? Are you concerned about anything? Do you know anyone else with breast pain who had something else because of the breast pain? So it's just also understanding what your worries and concerns are. They may also ask you about your family history. And when I mean family history, mum, aunt, sisters, anyone, a blood relative, have they got any history of breast cancer, for as an example, or any other cancers? So it's just a conversation or a chat to find a little bit more about the breast pain. And then after that, if everything is okay, the GP would want to physically examine you to see where the site of the breast pain is and see if everything is normal or not.
That's perfect, thank you. So what would you kind of say to people who have concerns about seeing the GP, like if they're concerned about wasting the GP's time or putting off going to the GP and thinking it's not serious? What would your advice be?
I think that's a very good question. Because of the NHS being so busy, the last thing anyone wants to do is waste anyone's time. This is not wasting anyone's time. We are here to have that discussion and speak to you and speak with you regarding understanding your concerns. So you're not wasting a GP's time, but it's also about understanding what's bothering you, what's concerning you, because there may be things which is completely normal. Breast pain is quite normal. Almost every woman will have breast pain some point in their lifetime, but it might also be a sign of something else. So it's definitely not a waste of time. And as I said, it could be a good chat about understanding what's bothering you. And if you do find something else, we can then take the necessary steps to help you address that.
So in terms of seeing the GP, especially getting an examination, obviously that can be quite an uncomfortable experience in the wrong setting. So what kind of things are in place, like chaperones, for example, to try and make people feel as comfortable as possible?
So chaperone is someone who will be present, could be during a medical examination, could be a procedure, or during the consultation itself. They're there to support you, to give you reassurance, but also protect you and the medical professional. The chaperone could be someone who's clinically trained, so it could be the practice nurse, the healthcare assistant, or could be a non-clinical member of the staff who is trained to be a chaperone. They're there to give you some emotional support, be an advocate for you, so understanding that breast examination can be an intimate examination, so providing the comfort and dignity. Also give you some reassurance and maybe explain the process to you as well, so that there isn't any misunderstanding or even from a doctor's side an allegation of an inappropriate examination. And occasionally a chaperone might help the doctor with the examination itself.
So what are the patient's rights regarding chaperones? How can a patient ask for a chaperone? Can they ask for a second chaperone?
So having a chaperone is really important, particularly if you feel vulnerable and if there's an intimate examination. So breast examination, examining the back passage, examine the front passage as an example. So you have a right to ask for a chaperone. And you may have declined a chaperone at the beginning of the consultation. That does not necessarily mean that it's a no. Even in the middle of the consultation with your GP can say, actually, I've changed my mind. I would rather like to have a chaperone. Equally, you have the right to refuse a chaperone as well. The GP may say, well, it might be better to have a chaperone, as I said, because it protects both you and the GP as well. You have the right for dignity and privacy, so don't feel pressurized to be examined if the chaperone isn't present. You can wait till the chaperone is there. Also, you have the right to be informed. What examination is the GP going to do? What are you going to be expected to be examined? And during the examination, if you feel uncomfortable or you're worried about anything, you can ask the GP or the clinician to stop and refuse the examination. So those are generally your rights as a patient.
So obviously GP appointments are generally quite short, and it can be quite daunting thinking, how are we going to fit all of this in? How are we going to make the most of the appointment? Do you have any tips on how to make the most of these short appointments and make sure that all the right questions are answered?
Yes, so that's right. GP appointments are generally about 10 minutes, so it's a lot to cram in at that 10 minutes. So maybe a few tips. One, be prepared. It's not a bad idea, maybe just even to list down what the symptoms are. Maybe a bit of a summary, what's bringing it on, and that sort of advanced preparation when you come to the consultation with the GP. Try to be clear and concise, rather than saying, I'm not feeling well, but saying, look, I'm getting the sharp pain in my right breast when I'm reaching out, or I'm getting it started day before yesterday, and I've taken paracetamol and it has gone away, or I did a marathon the other day. So it helps to try to understand where it is. Also, say any other relevant information or things that you're worried about. For example, you knew of an aunt who suddenly had breast cancer, for example, and they presented with breast pain. So it helps us to understand what else is bothering you. Equally, during the consultation, don't feel afraid to ask questions. If you need to clarify anything, you've got any questions, ask. How can I treat breast pain? What are my treatment options? And most importantly, at the end of a consultation, try to understand what the next steps are. What's the follow-up? If the pain doesn't go, what should I do next? Whom should I speak to? And in this day and age where everything's there on an app and on online, what are the useful sources of information that are reliable, fact-checked, so it doesn't increase any anxieties you have? So all of those are sort of information which you could prepare beforehand you see a GP and make the best use of that 10-minute consultation. You may have some other questions as well. So bearing in mind, just having that little bit of structure might help in focusing on the areas that is really important for you. And if you have multiple areas which you want to discuss, we would say maybe think about asking the GP to book a double appointment so there's much more time to discuss the other areas as well. Because you don't want to finish with a half job done, and you don't want to leave the consultation group thinking, gosh, I wish I had asked that question.
Thank you. Those are some really good tips. So if someone is experiencing breast pain and they're not cisgender, how might that impact their experience of an initial GP appointment?
That's a very good question. And the simple answer is that should not affect their experience at all. They should expect exactly the same as anyone else. Again, the GP would want to take a good history, a chat with the individual to understand what type of pain is it, what brings it on, what takes it off, what makes it worse, and to understand the nature of the breast pain. But sometimes another reason for breast pain could be is the gender affirming treatment and whether is that related to that. So if that is part of the reason, then you need to take that into context with regards to the individual's treatment and see what's best or how to manage the breast pain.